Good afternoon, everyone. Welcome back to our channel. We are so excited because we have a special guest with us today, Dr. Manh Dang. He's one of the oncologists here in town. We're going to talk about faith, medicine, and healing. We're also going to discuss his new book, The Fields, which is a compilation of short stories and inspirational thoughts. We're excited to have him on, so let's go ahead and let's get started. All right, well, man, thank you for joining us today. We are so excited that you are here.
Thank you, Dwayne. Thank you for having me.
Awesome. Well, first, why don't you tell us who is Manh Dang? What do you do, and what made you choose oncology?
Uh, I'm Manh Dang, and I'm a medical oncologist in Huntsville, Alabama. Um, I'm an immigrant from Vietnam. I came here when I was 15 and grew up in the South and went away for training and came back to the South. Why I go to oncology? Perhaps because in this most simple word, it's a calling. Um, like you, during our internal medicine training, we went through different specialties, and I just feel oncology is most compelling to me. Is my personality, my aptitude, perhaps fit oncology the best. When you take care of an oncology patient, you don't treat just cancer, you treat the whole person, different aspects to a person. So, and you also treat other illnesses too, not just cancer. So that's attractive to me.
Well, so we're talking today about faith, healing, and medicine, and there are so many different aspects of that we talk about. Let me go to your book first, and I think this is going to kind of set the stage for a discussion. And you begin by quoting a one of my favorite movies, actually, Brothers. What we do in life echoes in eternity. This is, from a Maximus, right? Russell Crowe is
Right.
starring in the movie, and you describe the scene before, right? So he's getting into the movie, kind of a leisurely, peaceful scene. He's walking through the fields, and the wind is blowing, just very serene. And then it jumps to the scene that you describe. He's staring into the Black Forest, and he's preparing his troops for the battle that's about to come. Okay, so that's where we are. And a lot of times we find ourselves in our lives, we're kind of minding our own business, right? So COVID, so everybody's going along, everybody is going about their business, and boom, COVID happens, and the entire world gets shut down. And people are in their lives normally, and they are going about their business, and they get that diagnosis, right? You have cancer, and so you're an oncologist. So let's talk about that. What when you see someone, they come into your office and they get that diagnosis, describe for me a little bit about their state of mind. What do you say to them? How do you usher them into that discussion?
There are a lot of fear, anxiety, and uncertainty. Um, so they come in not knowing what the prognosis is going to be, how it's going to be, what the path ahead of them will be. There's so many aspects of the cancer care, not just the physical aspect, but the emotional aspect, the social aspect, and so on. So we first try to make them at ease the best we can. I introduce myself and let them know that we're here for them. We will we'll work with them, work alongside with them. yeah, we try to allay that fear the best we can. And we go into the nuts and bolts of diagnoses and prognoses and um, how the treatment is going to be. And it's a relationship between caregiver and patients. It works both ways. We try to get to know them, identify their needs, and they will try to understand and know more about us. It's a difficult journey, but we try to make it as comfortable as much as possible early on. Um, so that's, but fear, anxiety are the two most prevalent emotions they will show.
So we hear a lot, and there's so much data. So many people have written articles, even books, on the role of faith and belief in
Yes,
medicine, in not just cancer, but in lots of other medical things that we see on a daily basis. First,
right,
tell me what is faith? What does that word mean? What does that word mean to you?
right. Faith is to me, is the belief in the goodness of God in all circumstances, even in the midst of a storm. Um, in my life, in my practice, it could be believing in light at the end of the tunnel. In There's a high purpose in suffering, and there's an answer to every question, even when that answer is not obvious now. Um, Faith is important in all aspects of life, and medicine is no exception. Um, Faith gives us hope for the best outcome possible. But even after we have tried everything we could and the outcome is not what we looking for, there's that hope of a greater purpose. And it gives us peace. It gives us peace when we face the challenges of the disease and the treatments. As you can imagine, the treatments in my profession are not always easy. Um, I think faith and medicine should be complementary and not adversarial. And that, like you alluded to earlier, there are numerous studies that show that people with faith, those that attend services on a regular basis, tend to fare better in their illnesses. They tend to live longer. That could be because they have better social support, they have better support from church. They tend to be healthier. The incidence of um, hypertension, for example, is lower. They have less anxiety and depression, and perhaps they live their lives more cleanly, so to speak. There's less alcoholism, less smoking, less addiction. But however you look at it, directly or indirectly, faith has a extraordinary importance in medicine.
And so, you know, I treat patients with diabetes, thyroid disease, thyroid cancer, and often we have someone who comes in, okay, and they get a diagnosis, whatever it may be, and the person really is in shock. They may be angry, frustrated, why me? And sometimes they will even try to put that out of their minds, like, it doesn't really exist. It's not
Mhm.
there. Okay.
Right.
Where is the line between faith, that is someone saying, you know what, I believe that I don't have this disease, I'm going to be healed, it's not as big a deal as everyone's making out to be. Where's the line between that and really saying, okay, I've got a disease, let me talk to the physician, let me surgery, let me have the radiation, let me have the chemotherapy? Where's that line usually?
Sure. So there is that line between medicine and faith. And sometimes we have to cross that line, and most of the times we shouldn't. Um, for that particular patient, for example, if someone comes in feeling that they just need to rely on their faith, the faith-based healing, for example, my usual take is that God is the author of all things good, and medicine, when used for the purpose that it's intended for, is good. So God is the author of good medicine. So believing in God doesn't mean that we just rely on prayers. We should, but we also should receive the blessings from God, and the blessings may come in the form of medicine, in medical treatment. So I would do my best to convince them that, yeah, your faith will ask you to pray for deliverance and for good results from treatment. But please take the treatment. It has the blessing that will also come from God. Um, as far as denial, yeah, that happens, and not always easy uh, to to convince patients that yes, you do have a problem, and it's real, and it can be fatal, and we need to deal with it in the most intelligent, faithful way we can. But we need to work together.
What role does gratitude play in this whole process?
Yes, when you face death in the face, you have a different perspective in life. Um, Everything that seemed important before, all of a sudden, are not important now. Um, every little things that we take for granted become so much more meaningful and precious. The relationship between you and your loved ones, you and your church, become much more important. So they and I as well become more grateful for every blessing we have. And in my book, I wrote about blessings. Everything we have that's good is a blessing. And sometimes the most important gifts of all are the little things, the little gifts that we already have. It's not usually the materialistic um, treasure that we're accumulating, but the relationship that we have with God, with our loved ones. So a lot of my patients know that, they become more grateful for every little thing they have, the opportunity to do the simple things, just to go to a wedding, a graduation, become monumentally important to them. Um, so gratitude becomes much more focused, much more um, in tune with their faith when they face death. Um, yeah, it's one of the privileges that I have as an oncologist, is to witness that incredible faith that these people have. And you really don't know how strong your faith is until you're in the depth of the valley. And you can imagine some of them are in the deepest part of their valleys, but they shine. They shine. And one of the um, shining examples they have is to show gratitude, to show grace, and courage and peace. So that's the consequences of having faith, if you will. And gratitude is definitely one of them.
And I love how you actually describe that in the book. You talk about the difference between love and hate being just a simple emotion, right? And let me see if I could read that here. And this is in the section entitled December in the South. The difference between life and death is only a heartbeat, but an ocean of joy and sorrow. The difference between love and hate is one emotion, but a lifetime of bliss and turmoil. The difference between darkness and light is just an instant, but from them, one can be lost or found. That's incredible. What role has your faith played in how you see your patients, how you treat your patients, how you interact with them?
Certainly. Well, faith gives me assurance. Give me assurance that good things will work together for the good of those who know God and love God. And from that assurance, I have peace. God, after all, is the ultimate physician, and I'm just a tool. I have to admit, it's not always easy to have that peace. I still grieve for the loss of my patient. As I get older and my faith is more mature, I find that peace more easily. It teaches me to be more humble. I need to set aside my pride and be more empathetic to my patients. As physicians, sometimes we have that pride and what I say go. But patients have need, and sometimes they come to us not just for physical ailments, but they have other needs. They have social needs, they have emotional needs, they have spiritual needs. And it's within my responsibility to identify those needs and assist them in whatever way I can, especially in difficult cases or challenging cases. I find myself on my knees before I go to my head and come up with the treatment options. So yes, faith, I believe, makes me a better physician, makes me helps me have the assurance and the peace. So it definitely directs my steps and gives me the need that I have to be a more well-rounded physician.
You tell a story that was really touching to me about a young woman who was pregnant and got the diagnosis of breast cancer.
Yes.
Tell us a little bit about that story.
So there are two stories. If I may, I could tell you both.
Sure. Yeah.
Go ahead. Two stories. Long time ago, after I finished my training as an oncologist, I worked for an HMO in California, and my team took care of a young woman who's pregnant, and she was diagnosed with leukemia a number of years ago, but it came back while she was pregnant with a second child, and we waited until somewhere in the third trimester when it's safe to treat the leukemia. Unfortunately, it was never successful. She was refractory to treatment. So the whole time it was an effort of trying to keep her alive and to keep the pregnancy to succeed. And I remember we toward the end of her trimester, she was very sick, and we had to put the crash cart outside the room so that in the event that she coded, that we would be able to have the OB team to do an emergent C-section so that we could save the baby. So she was able to successfully deliver, but by that time she was so exhausted that the cancer came back with a vengeance, and she was having multiple infections. She was in a lot of pain. I was on call one night, and the ICU nurse called, and she was DNR, but there were so many needs that she had to be in the ICU. So she was in so much pain, they asked for me to put on a morphine drip, and I did. Her husband, who was stationed outside the country, was able to come back at the end and was able to take care of the baby while she was on her last few days of her life. And I remember that same night, a few hours later, I was called to perhaps turn off the morphine drip a little bit so that the husband and the baby could come in to say goodbye. And I did. And I remember this just like it happened last night. The husband put the baby on her chest and whispered into her ears, honey, we'll be okay. You go on, we'll be okay. And so she died a few moments later, holding her baby. I was not a believer then, and I remember thinking, there isn't any God. If there is, God wouldn't have let somebody like this to die holding the baby like this. And it was a dark night, and I remember feeling very hopeless. And but there are many nights since then, and there are many more heartbreaking stories since then. But now I'm a believer, So I can I look for the stars beyond the darkness of the night sky. So that's one story. The other story is another patient that's pregnant when she was diagnosed for relapse breast cancer. First child, she was diagnosed with breast cancer when she was pregnant. It's a similar story. So we waited until later in her pregnancy and treated her. She went to remission. She was able to give birth a beautiful, beautiful baby girl. But after that, she unfortunately suffered a relapse. So we treated her with multiple courses of chemotherapy. And finally, there was one left. There was one drug left that we hadn't tried, and I didn't have much faith in it, but I tried. And amazingly, she responded well and went to remission and actually lived 2 years. Um, and ultimately, she succumbed to her recurrent cancer. But in those 2 years that she survived, she wrote letters. Letters to her daughter that are meant to be read by the husband until the daughter could read the letters herself. And I remember there's one letter that's supposed to be read when the daughter is to go to kindergarten, another letter that is to be read when she, by that time she's old enough, that the daughter could read when she turned sweet 16, another one she can read when she gets married, and so on. So to me, that's a miracle. God gave her 2 years so that she can write these letters, so that she can be alive in those words from the letters when physically she's long gone.
Now you write about that story here. You say, "I believe I knew her heart." So you don't know what the letters say. But you say, "I believe I know her heart." And if I'm to guess at the essence of her letter, it would be something like this. "My daughter, even though I'm no longer physically here, my love for you is everlasting. Though my spirit is heaven-bound, my love for you will be evident every time these letters are read. There will be a time that you will see me again, and I will personally tell you that there is nothing that could separate my love from you. Until then, or until that day comes, these letters will remind you of my promise to always love you." Wow. Powerful words. Powerful words. You in the book continue to talk about so many different things, but there is one story I'd like you to talk about. You said that you came when you were 15, and you guys, I think at the time, were driving across country. Your dad had gotten a job in the Carolinas, I believe.
Yes.
And you stopped at a diner.
Yes.
And you met, or actually I don't even think you met her. There was a woman that did something there. Tell us that story. And,
Yes.
and what it has meant to you all these years.
That story I also remember like it happened yesterday. That was 1975. It's a long time ago. So yes, we are immigrants from Vietnam, escaping communism, escaping the war, and so my dad and my family stayed at a friend's house for a couple of weeks. Then he got a job in South Carolina, and we drove across the country. I still have no idea how we bought the car. We didn't have any money, so that's another story. But we stopped at this restaurant somewhere in the South. I'm not sure it was Missouri, or we left Missouri to go to South Carolina. But we went to this restaurant to eat, and it's a small country restaurant, and we were the only family there except for one old woman, little old woman. And I remember sitting there eating, and I could see that she kept staring at us with a beautiful smile. And she left before we finished our meal, and we left as well. And when we came to the cashier, of course, we were told that she already come for the cost of the meal. And so that's my first experience in the generosity and the grace of an American. And it touched my heart. Um, in the book, maybe I said something like she's probably a guardian angel in disguise and coming down to greet us and to show grace. But that changed my life. You know, I ever since always have the desire to give back to this country who has embraced me and my family and given us the opportunity to have freedom and to live and to thrive. And when I became a Christian, that desire grew stronger. So my passion is international medical mission work, and it probably stems back to that experience that I had.
One of the things that you write in the book, along with talking about this woman, is you say that there are a couple of things that you want to. Let me see if I can grab that here really quick. There are a couple of things that you want people to really know, and I'm going to go ahead and read those here really quickly. All right. The good news, right? And that's how you begin. The good news is no matter how difficult our battles in life are, God has already sent his son Jesus to fight and die for our eventual salvation. And the other simple truth is that God, who walks with us in the fields of eternity, will not abandon us as we walk through our fields of life on this earth. So thinking through, as you see your patients as you go through, how have you seen their personal faith work in their disease process?
Yes. I again, one of the privileges that I have as an oncologist is to witness such incredible faith in a lot of these patients. Like I said earlier, when you're in the depth of the valley, your faith shines. It's almost like the light of the North Star shines on you and it brings out the good in you. And that's what my patients show. They have incredible grace and courage and kindness. They have peace. They have peace that no matter what, they are saved. So if in God's mercy, if they're able to live longer, that's a blessing. But if not, they will rejoice in that, in the fact that they will go home to be united with God in heaven. You know, they sure of that place that the scripture says. Let me see if I can quote it correctly. No eye has seen, no ear has heard, no mind has conceived such a place. And it's also a place that God has promised that he will wipe away every tear from their eyes, and there will be no more death, no sorrow, no suffering, no crying, no pain, for those things have passed away. They firmly believe in that. So they go through the fight with against cancer with such dignity and peace. But that's not to say that they don't have moments of fear and disappointment and doubt, but they always fall back to that place of faith. It's like the foundation where they wage the battle against cancer. It's faith. It's usually faith, family, and friends. The three F's: faith, family, and friends. And those are the sources where they draw the strength from. But yes, they will navigate through the challenges of cancer with such dignity and grace and acceptance. And you can see the difference between those patients and those who struggle with faith, and those that don't have faith tend to have more difficult time accepting the outcome if it's not good. So definitely, it plays such an important role in their life and in the battle against cancer. By
Wow.
the way, if I may add one more thing,
Sure.
they are
Yeah.
such witnesses to people, including myself, and their faith strengthens mine. So that's one of the honor I have as an oncologist, to be a, to see that, and it makes me a better person.
Wow. Wow. Yeah. Well, so as we kind of round the corner here, tell us, and you did such a good job of writing the book. Tell us one of your favorite stories from the book. I'm going to ask you two things. One of your favorite stories, um, how it impacted you, and then take a moment to talk to those people who are even right now struggling with this diagnosis. They are afraid, they are confused, they're angry. So let's start with the story.
Um, I have so many favorite stories, so I'm going to pick out one, and um, perhaps one of them is a story about my friend. He's diagnosed for lupus years ago, and one of the complications of his lupus is anemia. So, and he would come to see us on a frequent basis, and he would require blood transfusions on a very frequent basis. But he has such deep faith, and he would go to the transfusion center early, and he would pray for the nurses. They would form a prayer circle where he would pray for every one of them. Um, he was looking forward to that, to blood transfusion, so that he could see the nurses. Um, and every time he ended up in the hospital, he would call it a favor. And I asked him, "What do you mean by that? You here, you're in bad shape, and we have to, bail you out. What do you mean favor?" And he said this: "Every time I'm in here, it's an opportunity for me to share my faith and to witness and to minister to the doctors, the nurses, um, the cleaning lady, the phlebotomist, the lab technician, the X-ray technician." So he considered that an honor. Um, so before he died, unfortunately, he died of complication from lupus. He was very accepting, and he knew where he's going, as we discussed earlier, to that heavenly place. But here's the joy, and even when he was sick and was in pain, he sought out other people that had needs. He volunteered as a cook for a local soup kitchen. I had an opportunity to go shopping with him, and he knew every clerk, everybody in the grocery store. He knew every aisle. He's a light, in the world full of darkness, and so that's probably one of my favorite stories. That's he gave me inspiration and strength to continue to do what I'm doing, but also to look for other things outside of our profession to be a witness of faith. Um, I will share with them that there's a purpose for everything, and we don't know all the answers, but someday we will. I don't know why you are diagnosed with cancer, but we will do everything we can to to fight it. Um, uh, have faith that whatever comes out of this battle, that will be good. Um, Hopefully, that means that you will be cured from the cancer, and we will see each other as friends. Um, but in the event that it doesn't go well, there will be a deeper meaning in your journey, in your suffering, and we will see that perhaps not in this life, but in the next. We're here on Earth temporarily. See, this is just a stop. Um, we'll be in heaven someday, and that's an eternity. But while we're here on Earth, we do everything we can to lift each other up and help each other and treat each other and inspire and encourage each other. Um, and I promised them I would work with them, um, and do everything I can to be of service to them. Um, and that's the best we could do for each other.
Wow. Thank you so much. And thank you once again for joining us today. Amazing discussion. I hope you'd allow us to bring you back in the future to discuss some other things.
Thank you for having me.
Thank you so
It's
much.
an honor.
Appreciate it. Yeah, definitely.
Thank you, Dr. Woode.
So what a wonderful conversation we've been having with Dr. Manh Dang, one of our oncologists here, the author of the book, The Fields, a collection of short stories and inspirational thoughts. You know, guys, if you've not already done so, if you're getting some benefit from our channel, go ahead and hit the subscribe button below. Go ahead and share, like, let us know in the comments what are some things that you like about what we're doing. On this topic, if you are or a family member is suffering from a diagnosis of cancer, if you're afraid and want to know what to do or have questions, go ahead and drop those in the comments. Let us know what your journey has been. If you have a story that you'd like to share, we'd love to hear that. That's what we're about here. We're building a community, we're building this channel, and we are educating you. Thanks for joining us. This is Dr. Dwain Woode from Diabetes and Endocrine Wellness Center and The Light Away, educating the public for a better you.